So a new Thrive by 5 report has raised concern, and this is over child nutrition in South Africa. According to the report, thousands of 4-year-olds in South Africa are stunted due to poor food security. The study found that children who are enrolled in early learning programs are the worst affected by this, with nearly 1 in 5 showing signs of moderate to severe stunting, a condition that leaves them behind in months in their development. For more on this now, we're joined by Amanda Edwards, who's Head of Monitoring and Evaluation at Grow Great. Thank you so much, Amanda. Welcome to the agenda. So let's start with some context. Maybe if you can just tell us what is stunting for those who don't understand.
Right, good morning, and thank you for the opportunity to join you. I think it is important that we start with the definition of stunting because it is largely misunderstood. Basically, what stunting is a preventable condition. It's caused by chronic malnutrition with pregnant women and children in the earliest years of life, and it's when a child is too short for their age. It's basically them not getting enough food and care to help them develop, grow, and thrive at the level they need to. And the Thrive by 5 results have really highlighted the consequences of this, particularly for learning in the earliest years of life.
Yes, and we are seeing this, come in the form of our schools, particularly when we look at the underdeveloped communities, when you turn your focus to some of the rural communities as well. I'm talking about your Impendle as well as your Ikopo villages as well, where you'd have some parents not even being able to pay attention that there could be an underlying problem. Just how important is awareness around this, particularly when we try to build these young people growing up?
It's absolutely critical. It starts with awareness. If we're not sure how big or how far the problem reaches, we're unable to do anything about it. And I think that's where the Thrive by 5 index has been critical in showcasing where we are at as a country for children under the age of 5.
So what are the biggest barriers preventing children from accessing early childhood learning programs, especially when we've had so many conversations on how, education is growing in the country and how all of those communities that we speak about now have been benefiting from it?
I think some of the critical barriers are obviously cost of entry. So what we found in what the Thrive by 5 index found is that the biggest barrier to entry for a small subgroup of children was the fees that are charged by ECD centres, but recognizing that these ECD centres often don't receive any other forms of support. So it's critical that we as a country start to strengthen the support networks that surround ECD centres, but also ensure that those most vulnerable who are not sitting in ECD centres aren't facing the critical fee barriers that allow them access to entry. Because this has a consequence for children who are also not getting enough food. If they're not getting enough food in their home, an ECD centre can obviously can sometimes play a pivotal role in being a place where they receive a meal, where they receive the healthcare and support that they need to prevent stunting and ensure that they access the early learning they need to thrive and survive at school.
Look, and it's a very important point that you raised there. And food insecurity is a central issue here. How does the lack of a consistent, nutritious meal contribute to stunting?
It's absolutely critical. And I think one of the things we have to remember is that a child's brain doesn't start to learn when they enter school. It doesn't start to learn when they're born. When a mom is in her second trimester, the neurons that a child's brain is forming are millions per second. And that the quality of those neural connections often depends on what a mom is eating. So we have to get better at supporting pregnant women in the earliest years of life, even from conception, to ensure that she is receiving adequate nutrition and that those children, when they are born, have the best start in life with the nutrition that they need before they even reach an early learning center. And I think that's something that we have to look at with the Thrive by 5 as early as possible, but we also need to move earlier and see that pregnant women and young children are receiving nutritional support and care that they need. And that's one of the biggest things we can do to prevent stunting in the country at the moment.
And I want us to touch on those ripple effects, on what this means for South Africa as a country and what needs to be done or prioritized in order to address this issue, particularly when we also look at how the various departments have been jostling to ensure that they at least try to lend a hand. And you find that some of those efforts, albeit as they are not really enough.
You're absolutely correct. So the consequences of ignoring this problem are dire. We've got children who are learning worse, they have higher rates of school dropout, have lower employment and earning potential, and ultimately poorer health consequences where they're often suffering from higher rates of heart disease and diabetes. But the economic modeling that's been done on stunting shows us that if we can solve this problem, we have the opportunity to increase our GDP by 9%. That's the economic impact that stunting is having on our country. And it's going to take a whole of society approach. We have to look at an individual level where in households and in communities, we're supporting pregnant women and young children to receive the nutrition and care that they need to thrive and grow well. But we also need responsive health and social systems to ensure that children are getting the support they need from the earliest years of life. And that's where the Grow Great campaign comes in. We are demonstrating and partnering with government and other businesses and civil society sector to ensure that children are getting free antenatal and the pregnant women are getting free antenatal and postnatal care through our Flourish programs, and the community health workers in the front line of work are able to find and support children who are not growing well within households. But it actually takes more than just the responsive systems and individual work. We need leadership at the highest levels of government, business, and civil society to ensure that we collaborate and prioritize stunting as a national priority. It's only this collaboration that has shown in other countries to get us over the line and reduce stunting in the long run.
The sense is that it will take all hands on deck. I must thank you so much for your time. Amanda Edwards there joining us, who's the head of monitoring and evaluation at Grow Great. Thank you so much for your time and insights right here on the program.